As regards to the reemergence of Ebola outbreak in Africa, we have Dr. Shayin Madaki, the former NMA chairman, Kaduna State chapter, who joined us live via Zoom. Thank you so much for being a part of the news at this time.
Thank you.
All right, so how would you react to the recent report of an outbreak of Ebola and Lassa fever?
Well, I think for Lassa fever, it's an annual thing. I think it's endemic in Nigeria and many West African countries, really. So it's not surprising. We usually have the peak of it from December to April. So we're having that wave right now currently. So but for Ebola, a case was reported, I think, on the 30th of January this year in Uganda, and the index case happened to be a nurse who manifested symptoms of viral hemorrhagic fever and later died. So postmortem confirmed the case of Ebola, but since then, no any other case has been reported. So there's really ongoing surveillance and close contact tracings, monitoring to ensure that it is contained. So thankfully that has happened for now. Yeah.
All right, do you think Nigeria is better equipped as a country to control the outbreak of this disease, looking at how the nation has been able to curb the outbreak when it earlier came in? Do you think we are still or are right now equipped to, control the outbreak?
Yes, I think we are, and really Nigeria has shown capacity even from the last outbreak of Ebola. We must give it to the Nigerian resilience, and even despite our many challenges, we've shown capacity to be able to handle that such outbreaks. And even for the Lassa fever, I think we're not doing bad. Currently, with the Nigerian Center for Disease Control, all the measures that are being taken in, and having those treatment centers, specialized treatment centers, infrastructures for prompt diagnosis and treatment. I think we're we're capable, we have the capacity to do that, but not without the challenges that the health sector is facing. So if you have reemergence of these diseases, it's going to just be more strain on the already weak health system that we have. So the capacity is there, but the challenges also are there.
All right, so as a medical doctor, what would you advise must be done to avoid future occurrences of these disease, narrowing it down to Nigeria?
Yes, in fact, what we should do is it's what we've always been saying, and that includes strengthening of the health infrastructure, building capacity, and what have you. One of the challenges that we've been having in terms of this such emerging diseases or re-emerging diseases rather is a strain on the resources. The resources, when I talk about resources, I talk about funding. I also talk about the human resource for health. Already we have so few health workers. The few we have, we cannot retain them. So you train people today, by months to come, they are looking for ways to migrate outside the shores of this country because the working conditions already are poor. And then, of course, the infrastructures themselves. Although we've done well in terms of management of Lassa fever and even Ebola in the past, not without the support of WHO as it is. So what we need to do is to keep funding, increase the human resource for health, talking about retaining even the few we have, and also being able to attract people to actually come and join forces with us, because we cannot afford another major outbreak, really. So that is it. And then also ongoing education of the public awareness campaigns that also has been going on But you find out that a lot of people will either don't pay attention, or they have not really, adhered to some of these measures that have been reeled out as public awareness campaigns. You hear them everywhere on radio, on TV, the newspapers, and what you need to do and what you shouldn't do and all that. But generally, people have not internalized that. So we need to also keep that going as much as possible. And then, of course, collaborations in terms of with other agencies, whether within the country or outside, in terms of research, trying to find, develop vaccines that can prevent these diseases. Ebola, for instance, I think there's progress in terms of the development of the vaccine. And there's recently we read that in Uganda, in the same Uganda, there was some, um, um, you know, we had made some gains in terms of that. But for Lassa, it's still very far getting any vaccine to prevent it. So if we
All
can
right.
invest in such places, I think it will go a long way to help in the long run.
Thank you so much, Doctor. Thank you so much for your time and for being part of the news at this time. We do really appreciate your time.